Welcome to the topic where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Todd Duplantis. During this crisis right now, we're all very grateful for our frontline medical personnel, and perhaps no other group is more frontline than EMTs and paramedics. We're joined today by HCC's EMS Program Director, Vicki May, joining us now to talk about how HCC is invaluable in training the next line of personnel to go out into this industry. Vicki, welcome to the show.
Hi, thank you.
So I want to talk to you about the current events that are going on right now, and maybe how this has changed the industry, or as you've noticed it. First and foremost, for the men and women out there on the front line, the EMS personnel, the discussion of PPE now seems to be more important than ever. Was this a practice that was used extensively before the COVID crisis? And obviously it's something that has to be looked at in the forefront right now.
Yes, it's always something that we've taught simply because we've been exposed to bugs and viruses ever since I started practicing and before then. So we've always taught the students to do personal protective or use their personal protective equipment. I don't know if it was used as extensively as it is today. Certainly not everybody that we made contact with before did we use the gloves and the gowns and the masks. So we didn't do all of that like what is going on today.
What is your own personal opinion from viewing what's going on with EMS personnel out there? I mean, you're hearing in the news about the numbers that are getting sick with this virus. Is this something to be expected? And is this something you have to take in consideration when you go in this profession?
It's always something. You know, years ago when we did we used to do the face-to-face orientations, I had a mother come in with her son. And after we did the orientation, she heard about what we did and what the job was all about. She said, EMS is really like the Marines because we're the first ones on the scene. We can't decide who we're going to treat. We can't decide whether the patient is ill or not until we actually make contact with them. Certainly we get a dispatch information, but we don't really know what's going on until we actually make contact. And we certainly we can be aseptic, but we can't be sterile. So we've always been exposed. I think for the rest of our lives in medicine we'll be exposed because you simply can't outrun these viruses. A virus is something that's out there. There's plenty of them. Obviously, this is a new one that nobody's been in contact with before, which is why everybody's very cautious about it. But personally, I think within a year, we'll be talking about the COVID virus like we do the flu every year.
Have you had students, your former students, giving you any feedback? What have you heard from them who are out there working on the front lines right now?
Right now, I'll be honest with you, we actually have a couple of our current students that are working with some of the services. So we've had the Zoom meetings with them, and they say it's pretty crazy out there in the pre-hospital care environment right now. Of course, everybody is geared up and serious about every patient they make. Not that they weren't before, but again, in this world we're living in, it's a little different, at least for the moment. And if students or pre-hospital care providers are being exposed and they don't feel like they've been protected well enough for the exposure, then they're quarantined. They're sent home and quarantined for the 14 days.
And that's a whole new way of looking at things, because I imagine that wasn't very common practice a few months ago, right?
Not at all. I don't look at the flu bug. I mean, every year the flu bug hits, and yes, we have a vaccination for it, but it's about 40, maybe 60% effective. So just because you get the shot doesn't mean you're going to not get the flu. And look at the tens of thousands of people that die every year in the United States from the flu, but nobody really pays attention to it in the sense that we're paying attention to COVID-19 at this point in time.
For the EMTs and the paramedics out there working right now, many of them, like you were saying, are having to self-quarantine if they've been exposed. A lot of them are getting sick right now. Are you finding or hearing that the ones who are healthy and continuing to work, are they being overworked more extensively now than in the past?
Yeah, we have one young lady in our class that works out with the Montgomery County EMS group, and they do a 48-hour shift. And I think she said they probably ran on her last tour, they probably ran 36 of the 48 hours. So,
Wow.
so it's pretty crazy out there right now.
Are you having to change your curriculum and addressing the way you teach your students now because of what's happened in the past few months?
Todd, I've been with the college for 32 years now, and the only way I've ever taught this program is face-to-face. And now we're into this online education. So we really had to take a quick detour to get up and running. I do know that there's many of our students that are not really built for online education because it takes a certain type of person to do online education well. But so far, things have been going well. We've been doing our Zoom meetings with the students to keep them focused. And hopefully we can get this behind us shortly.
Once this is behind us and we get back to some type of normalcy, what type of changes do you see in the industry that are even standard now that we weren't not necessarily observing, but weren't practicing all the time a few months ago?
I think if anything, just as we started with this whole conversation, I think the fact that they're going to be very diligent in wearing their PPEs when they make contact with any type of patient, not just our respiratory patients. And I think if anything, that's going to be a good thing because like I said before, we really don't know what we're coming in contact with patient by patient. So to be safe and just something as simple as using the PPEs is going to be I think a wonderful thing for the EMS profession.
You're hearing a lot in the media right now that the PPEs aren't readily available to the EMTs and the paramedics. Are your students telling you that they have a suitable amount for them, or are they having to reuse it? What is your opinion towards that?
From the students that I have talked to, they're telling me that things are in pretty good shape. They're not really having to reuse, and they are getting the supplies that they need.
Well, that's good news, and that's good to hear that because you certainly hear a lot different thing with
Right.
the need to get the devices out, and I know there's a national push to build more. HCC has jumped into that mission to help provide more to the medical community. So there certainly seems to be a need, but from what you're telling me, that need may not be at all the paramedics. It may just be certain groups, maybe.
Right. Certain EMS systems, the students that I deal with are from just a few different services throughout the area. So I can't speak for all of the services throughout the community.
Vicki, we're going to go ahead and take a short break. When we return, we talked about the fact that you're now delivering education online and teaching your students online. I want to talk more about that, how that transition's been, and talk more about what students can expect as for the next couple of months until we get past that. So stick around. We're going to go ahead and take a short break right now. When we return, we'll have more on this very important topic on the show. Stay with us.
This is Ronik. She's a mom with a physics degree, so she understands the power of momentum. And she knows that by learning English at Houston Community College, she'll be unstoppable. HCC, for everyone, anytime.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Meet Lisa. When she's not moving to a Zydeco beat, she's making moves towards a better job with a nursing degree from Houston Community College. Ça c'est bon, Lisa. HCC, for everyone, anytime.
Welcome back to the topic. I'm Todd Duplantis. COVID-19 across the nation, it's certainly an issue that we're all dealing with right now, but no more than our EMTs and paramedics. And as you know, Houston Community College has a long history of training EMTs and paramedics, and we're joined by HCC's EMS Program Director, Vicki May. We've been talking, Vicki, about the industry and the changes you guys have gone through. And one thing that kind of struck me you talked about is you've been with the college for more than 32 2 years. And this is the first time you're really doing the online learning because you're used to meeting with students up in face-to-face, I guess, huh?
Yes, definitely. And really and truly, like any other workforce program, or at least most of them, I would imagine, you can't completely do this type of education online. So what we've been able to do is translate into our cognitive learning. So book knowledge, instead of lectures, now we're moving the students through the chapters in a little different fashion by doing discussions and checking understanding differently than the face-to-face. But at some point in time, we will have to get back on site, on campus, so that we can actually do the skills that are required of the profession. You can't really do skills virtually, okay? You have to be able to do the skill physically so you can build that muscle memory. So when it's time for you to physically do something to a real life patient, you don't really have to think about it. You can just get in there and do it.
Well, you're bringing up a subject now that's been asked in our social media by many of our students, not just your students, but students who attend Colvin College, students who may be welding students, and they're wanting to know what happens to me because I understand you're going to we're on online courses, but I can't weld and I can't learn how to work in the simulated environment online. So it sounds like it's more or less a case-by-case basis depending on the discipline. But you guys will help the students transition to the next phase when we can get back in the buildings.
Yes, definitely. We're making plans for all of that day by day. We do have meetings with our dean 3 times a week, so we're making plans as soon as the chancellor and the system is ready to allow us to go back in on campus. Is when we'll be able to complete the students up for the spring semester.
I know a number of your students, as we mentioned earlier, are already working in the field. Are they still allowed to work in the field right now if they're doing an internship or something along those lines?
No, at this point in time, the clinical rotations have shut down. The hospitals have basically told us that they just don't want to be responsible for the students, which I completely understand. Same with our EMS affiliates. But as soon as the all go happens from the governor and the president, then I think maybe we can phase back into the EMS rotations. It may take us a little bit longer to get back into the hospitals.
It seems like your students would be welcomed right now with the shortage of staff and people getting sick out on the front lines and people being overworked. They may want some new faces and fresh bodies in there to help them work in this environment.
That's all true, but at this point in time, because they're students, they can't really leave us and go work. Now, we do have students that work for EMS services like we've talked about before, and the state has allowed and the governor has allowed if one of our students, let's say we have an EMT basic student that's going through the paramedic program, working with an EMS service, if that EMS medical director for the service will allow the student to ride up and practice and perform more invasive skills because they're in paramedic school, then that's something between the student and the EMS director. So that's always a possibility.
Has that happened as far as you know? Have you seen that happen in the past month or so?
We have not had any of our students that have been allowed to do that, no. That's not something.
So it sounds like it's still a very touchy subject. I mean, right now they're trying to do everything they can to keep the operations going, but you're hoping to get the students back in there hopefully as soon as possible.
Yes, as soon as things relax a little bit. And again, what we're hoping for is that as the president and the governor is talking about opening up the economy again, that all starts to happen here fairly quickly.
How does HCC partner with area medical groups and hospitals to get our graduates out there working? Do you help the graduates, have a department that helps the graduates find the jobs?
I'll be honest with you, Todd, with our students, because they do clinical rotations as part of the coursework, the majority of our students, while they're in class doing clinical rotations, so many of them are offered jobs while they're actually students, so that once they finish the program they're in and get the certification, we have basically between a 95 and 100% placement rate without any help.
We're currently enrolling for summer classes. Are there programs that students can take if they're looking to enroll for the summer that you can offer them right?
Yes, we are currently offering 2 basic classes. We have the Next Level Up. We have an AEMT class we're offering. So we do have ongoing classes for the summer.
And if they do take the classes, it's as far as doing the clinicals and stuff like that, they're just going to have to wait because you're offering the book learning at this point, correct? In the lectures?
Right. So we'll front load in the lectures. Hopefully, as we move on into the summer, things will open up a little bit more so we can get in to do the skills and then move them on into the clinical setting in the fall.
Do you see this whole crisis, how do you see it affecting your industry as far as more people maybe wanting to work in this industry? Or do you think it's going to be an industry that's going to be tough to recruit people? Where do you gauge the interest as we're going through this?
You know, I think that's going to be student by student. Certainly with the job we have, because we are considered essential personnel in these type of situations. Nobody in our profession has lost their job that I know of. So as far as getting into a profession that you're pretty much guaranteed a job if things go south like where we're at right now. On the other hand, you have to be that type of person that really wants to do medicine, has an interest in medicine, and understands that you may be exposed to things, but as long as you take care of yourself and do things right, you can come out on the other side just fine. For
someone who's looking to go into this industry, you mentioned about working 48-hour shifts and running maybe 36 hours out of those 48. Is that a normal thing to expect at this point? And what's a normal work week look for an EMT or a paramedic?
You know, it just depends upon the service. Some services run the 24 hours. They'll be on the job for 24 hours. They'll be off for, say, 48 hours. Some of them do the 48 hours on, 96 hours off. It just depends upon the service out there. Most of the students or most of the employees that we know of that work with us like that 48 on, 96 off. But it can be brutal. It can be brutal if you're in a situation like that we're in today. What
are the common characteristics that you find of people who want to go into this profession?
You know, you have to have somebody that has a lot of compassion. And then you have to have somebody that really has a great interest in medicine. And with those two things, this can be a wonderful job, a great job, very rewarding job.
We're talking with Vicki May, the HCC EMS Program Director. And Vicki, are you based out of the Public Safety Institute up at the Northeast College?
Yes, we base out of there. The Northeast College, we also offer classes during normal times. We offer classes over at the Katy campus as well as the Missouri City campus.
For someone who's looking to register for these, are these courses that normally fill up quickly? Would you suggest registering now as opposed to waiting till the last minute?
I would say go ahead because there are things that you need to get done before we can actually get you registered. There's certain documents that you have to get uploaded into a specific online platform. These would be your medical records and such so that we know that you're ready to go to clinical when that time hits.
Vicki May, the Program Director, HCC EMS Program Director, thank you for joining us here on the topic today. This is certainly one of the most needed industries, and you know, where our kudos go out to all your staff and your graduates out there who are putting themselves out on the front line, working tirelessly to help keep this country going right now. Thank you very much for being here.
Hey, thank you.
And I want to thank you for joining me on the topic today. Of course, you can download all of the audio versions of our show at hccs.edu/podcast. Make sure if you're watching us in Facebook or on YouTube, subscribe to our channel and make sure you share this post as well to get it out there for folks to get this information. Registration is ongoing, students. If you're looking to register for any of our programs, you can do that online. We will have courses online. It's underway right now at hccs.edu/now. For the topic, I'm Todd Duplantis, and we'll see you next time.